Welcome back, everyone. What a great conference we've had today. Let's introduce our last company for today. We have Avricore Health Inc. It trades on the OTC under the symbol AVCRF and on the TSXV under the symbol AVCR, and is a pharmacy service innovator focused on acquiring and developing early stage technologies. And through its flagship offering HealthTab, the company's mission is to make actionable health information more accessible to everyone by creating the world's largest network of rapid testing devices in community pharmacies. Please welcome its CEO, Hector Bremner. Welcome, Hector.
Hi, Anna. Thanks for having me.
We look forward to hearing about your company. The floor is yours.
Well, that's great. Well, again, thank you so much, and hello, everyone. Thanks for tuning in and listening today. It's really exciting to be able to share this story with you. We're extraordinarily proud of what we've been able to accomplish. It's going to be a story that you're going to hear a lot in the years ahead, frankly, is that pharmacy is changing. And it's a $1.6 trillion business globally. And this is a very exciting moment to be looking at this sector very carefully in a variety of ways. One way in particular is a field that we're addressing, and that is supporting them with technology for them to engage in more service-based revenue. This is going to be the fastest growing area in their business in the years ahead. They did exceptionally well during COVID. Regulators and governments around the world have noticed that, and there's a primary care shortage out there, and they are being viewed now as a place to fill the gaps in access to care. So we're going to show you how we're helping them do that with incredible tools, and with our partners at Abbott. We think that we're one of the most exciting stories in community pharmacy today. So as we move forward, this is an exciting area of innovation, and we've got really bright plans for the future, and we think it's underpinned by our near-term successes, realized successes rather than. This is not theoretical. This is something that we're doing now. We're in market now. We're generating revenues now, and we're going to show you how we're doing that. So as I mentioned, healthcare needs new tools, and the Internet of Things has invaded a lot of industries, from transportation. Things like Uber and Lyft and rideshare programs have revolutionized the way that we engage with what was the taxi industry, and now we use these exciting new companies. The hospitality industry, the hotel and entertainment industry, dramatically impacted by products on the market like Airbnb. And that has been the power of new ways of bringing technology into consumers' hands, and that's happening in healthcare now. Chronic disease is, of course, the big challenge that we all face. I'm based here in Vancouver, British Columbia, Canada, just north of Seattle. And whether you're in Canada or you're in the United States or you're in Europe, the story doesn't really change. People don't have physicians. Rapidly changing lifestyles and diets, stress, lack of physical activity, all the rest of it. It's all adding up to the fact that 71% of deaths worldwide are directly related to chronic illness. And chronic illness has got big impacts in Canada, where I am. $68 billion are the direct costs related to chronic illness. A third of Canadians, and that number is consistent and the same in the United States, a third of people either have prediabetes or diabetes. And if you're familiar with the stats around diabetes, it is typically called the gateway disease. That is, your risk of heart attack, stroke, certain cancers, liver and kidney disease dramatically increases with prediabetes and diabetes. But many people don't know that they have it, because the healthcare systems are sort of disease care systems that wait until you're symptomatic. And so 50% of Canadians have chronic illness, and so this number is consistent, again, in the United States, in Europe, in Asia, and so this means there is a large and fast-growing market out there to service chronic illness in a variety of means. And one way that you can really service it is not just waiting until an individual is symptomatic, but getting to them early. And so pharmacies are investing in technology to shift their practice from being simple pill dispensaries, getting into more primary care and health consultancy. So this means more disease prevention, early detection, screening, and moving them through a care plan to make sure that we're not just spending money on drugs, but we are actually driving them through a variety of care to minimize the disease outcomes and the acute care outcomes, keeping people out of hospitals in simple ways. So, our pharmacists have been really excited to work with us. Mohammed El-Zabkawi in Toronto, a really passionate advocate, and we've been so supported. And he says, I'm so excited to have HealthTab in my store because I believe it demonstrates a new and better way to do pharmacy practice. And this is something, if you look at Walgreens, CVS, Walmart, and every major pharmacy brand around the world, they are doing really incredible things to reshape their business, from closing stores to reinvest in the footprint of the existing stores, to expand the amount of services they can offer, adding new consultation rooms. Walmart and Walgreens have both announced clinical trial divisions, which is really exciting and something that we can support. But the big focus is a shifting practice of pharmacy. And point of care testing is a big way of they're going to be able to do that. Now, they obviously did a lot of point of care testing during COVID as people were looking for rapid tests. PCR test collection was a big point of revenue. And now the pharmacy has realized that this is not only a great revenue source and something that they can deliver. Now that we still have some aftershocks of COVID and still a lot of concern out there about infectious disease, they're realizing they can do this in these chronic disease areas. And so while today the point of care testing market is estimated to be around $36 billion US, by the end of the decade, it'll triple. And I think these numbers are conservative. So this is a very fast growing and exciting space. There's new tests, new instruments, new companies, a lot of really interesting investments in this area. However, we and our partners at Abbott think we have the best solution, and we will be taking a large portion of this chronic disease screening in community pharmacy. Patients want this. Many people here watching have probably done their 23andMe and had their genetics done and are looking at the impact of disease on their life and the risk of disease. You probably have several apps on your phone that could be related to healthcare. You might be wearing an iWatch and using or a Fitbit and using that to guide your health decisions. We know consumers want to take action on their health. They want more control. They want to be on the other side of the clipboard, as it said. They don't want to just be passive in their healthcare. And pharmacy is a great place for them to engage because it's the only place besides an emergency room you can really access healthcare on demand. So we're focused on becoming the world's largest, most reliable point of care network in community pharmacies. And so how we're doing that is with HealthTab. HealthTab was developed here in Vancouver by our president of HealthTab, Roger Seckham, who leads the team in implementation today. It is a cloud-based network that brings high-quality analyzers, which are typically found in lower volume labs or in acute care settings, normally a little bit too expensive for pharmacy, but we disrupt that model by networking them over the cloud and bringing them into the community pharmacy in a model which I'll describe in a second financially how we do that. But the patient creates an account. They provide consents. They do customized health surveys. That information is merged with the lab result in real time right there in the pharmacy. And they receive a consultation from their pharmacist using a data-driven conversation. The pharmacist has access to this information. It can be shared with their physician and other healthcare team members. But most importantly, the pharmacist can use this technology to adjust their dosage or even support them in getting a new prescription and keep them on a care plan. And another key piece of this, and as I mentioned, pharmacy is looking at and being viewed as a new place to conduct real-world evaluations, real-world clinical trials, and we can generate de-identified real-time data on large groups of people across many, many points on harmonized analyzers. And this is a major breakthrough in the ability to study treated populations in the community pharmacy. So we have several biomarkers that we can look at. The big one, of course, is HbA1c, which is blood glucose levels, and anyone with prediabetes or diabetes will be familiar with testing for that. But also looking at things like cholesterol and triglycerides. The instruments that we use can test for a variety of liver and kidney function issues, and we can even do real-time biological or viral testing right there in the pharmacy. So some of the machines that we're using from our partners at Abbott, who have been incredible, they really are the world leader in this space. And, we've taken time to look at a variety of analyzers. We have deployed other analyzers in the past, but in 2021, we began partnering with Abbott on the Affinity 2, which we're deploying right now in Canada, which is looking at the A1C, as I mentioned, and the lipid profiles. We also have the iStat, which can do kidney function. And then, as I mentioned, the ID Now, which was very successful during COVID-19. It was originally developed for influenza and strep testing. But now we also offer COVID testing and rare virus testing. So really exciting space in community pharmacy. And that's a confirmed result. It's not just a rapid test. This is a confirmed result that happens in real time right there in the location. So trying to understand how, from a revenue perspective, how this works and the market that we're addressing. So right now in the US, Canada, and the United Kingdom, there's over 100,000 pharmacies. And right now we are deployed in over 200 Shoppers Drug Mart pharmacies. We will be in 450 locations in Canada by the end of November of this year. So we're just in the midst of those deployments right now. The way that it works is the disruptive model that I was talking about before about making these analyzers more affordable is that we charge a system fee or a subscription fee per location. That includes the instrument, our cloud-based software, which is interpreting results and providing a user interface. We also include oversight by a third-party reference laboratory. So this is a totally validated program, and training and ongoing support. And we also distribute the tests. The tests are consumables. They essentially look like little printer cartridges. And the blood sample goes inside the test cartridge, goes inside the machine, and it's just discarded after. So we have decent margins on this, and we drive more revenue through higher throughput and volume. So right now what we're seeing is stores, just by having it at the location, using it fairly minimally, can generate about $1,000 a month. A focus store can do better than that. And superstars, stores that are really focused on services and really leaning in, generate very strong revenue per location. The superstar stores, we think, are really our window to the future, because remember, this is an industry in transition. So there are going to be people on the leading edge of this, and there's going to be those that follow. But I can tell you that these numbers are growing all the time, that the amount of tests being conducted every month is growing every month that the store is in operation, and the teams are extremely enthusiastic about using them. And given the policy environment changes, funding sources, and patient demand, we see extremely bright future for volume and utilization in the store. And so the network growth right now, this year we'll have 450 locations. We expect to grow rapidly in 2023 with our existing customers, plus adding new pharmacy chains in Canada and internationally. And as well, the year after that, we expect the growth to be quite exponential. So we're already seeing that line up now, and we're really, really bullish about the months and years ahead. Daniel St. Pierre, who's been a fantastic partner, I have to say, at Abbott Rapid Diagnostics. They've been really fantastic to lean in with us. As a small innovator, having a partner like Abbott has been really incredible, and I think lends to the level of seriousness and credibility of what HealthTab is doing. And so what's the HealthTab difference, or what would be the competition? And I'll quickly address these pieces. So first, we're dedicated to the pharmacy sector, and we're quite unique in that way. So in that way, we've been first to market. There are people that or enterprises that do parts of what we do. They may offer the analyzer, they may offer a software that is behind the pharmacy counter, they may offer an interface with users, but they don't bring all these pieces together. And this was the big thing that was missing in the marketplace, and we're addressing that. Quality control is something that's completely missing from point-of-care testing programs. They've been quite nascent and new, and they've been sort of figured out on the fly. But we have been a major leap forward in taking it extraordinarily seriously and bringing in a truly world-class reference laboratory, SQL Labs, and they are overseeing the lots and making sure that you're getting the best possible results out of this platform. We're harmonizing the data. Why that matters is that most people might not be familiar with the fact that a lot of studies are conducted on a quilt work of analyzers, and the analyzers, their reference ranges, and I don't want to bore you to death with this stuff, but different analyzers produce different results in different ranges. So it's not harmonized, and it's not really like apples and apples. It can be apples and pineapples. So it can be challenging from a research point of view to get reliable data. So we're really proud of the fact that we're able to harmonize the data and get that harmonized network of instruments rather, and get that data back in real time. This is a profound and major breakthrough. It's easily integrated. The setup is very turnkey. We took a focus on making this as simple and easy to integrate into every particular location. Teams can get set up in minutes, and they can get testing and that fast. So we're able to get a pharmacy going in very short order, and it's very easy for us to scale. Being, again, pharmacy focused and having a team of advisors that have allowed us to really drill down and be experts in pharmacy has been critical. We think having that focus is a big difference maker. This has been a tremendous breakthrough that pharmacy has gone through in terms of their shift in doing business, from going from dispensing to services, and they've needed a tool that was going to work for them, and something that's not just simply being repurposed, and the results of our success is showing that. And of course, bringing the patient involved in this has been really critical. I think one of the things that where competitors have not succeeded is that they've perhaps not recognized the uniqueness of pharmacy being so retail focused. Right? So the patient is very much a driver in all of this. It's much less so than normal primary care, where the physician is sort of talking at the patient. The patient really drives the conversation in the retail setting. And so this needed to be understood, and they needed to be engaged. And of course, you can deploy a lot of machines, but are they being used? And without the patient really driving that conversation, they won't get used. They'll sometimes people call them paperweights. They go there, and you spend a bunch of money on deploying technology, but it's really, the uptake on it is quite minimal. Whereas globally, we're confident in saying that we're one of the best utilized programs ever deployed, and that's because the patient is excited to receive the results over time. They have access to their data. They know how they're doing. They're taking action on their health. They're motivated month over month and quarter after quarter to see the results improve, and they're taking true control of their healthcare. And we know that has been a winning recipe. So Shoppers Drug Mart has been our first flagship customer, and we're just been so excited to work with them. They're Canada's largest pharmacy chain, and one of the world's most respected pharmacy chains. They collaborate globally, and I know that we've had leadership from major U.S. Chains come through the stores. They watch what Shoppers does very closely. They're real innovators and real leaders. So they've really leaned in, and we're doing some very exciting work with them. So as I mentioned, 450 Shoppers locations. We're also moving into their parent company, Loblaw's grocery locations, which is really exciting. And probably one of the more interesting things of all of that is the pharmacy walk-in clinic. The pharmacy walk-in clinic is a new concept in Canada, and something we expect to see in other countries is fewer and fewer people have access to a GP, just a family doctor. For those less serious episodes, healthcare issues, or those in-between moments, perhaps you already have a diagnosis and you're just getting a prescription renewal, going to see a pharmacist in terms of scope of practice is perfectly acceptable, and it's a proven model that's working, and it takes pressure off the family doctors, takes pressure off the hospital network, and pharmacies are everywhere, and people can walk in and get a consultation with a pharmacist very easily. So this pharmacy walk-in clinic model in Canada, which is is now operating in Alberta, is a runaway success. It's a very exciting model, and we're very proud to have HealthTab located there. And the results in patient data has been incredible. So when we launched the original pilot, it was about 20 locations. Initial focus was on diabetes, but the numbers became that 30% of patients had received a new chronic medication. Excuse me. 27% had been receiving dosage adjustments. About 50% of patients are receiving actionable health interventions. So, excuse me, this has been a runaway success, as I said, and patients have really leaned in on it. They're blown away by the fact that they can access healthcare so easily, and pharmacists, have been so excited to be able to come into work every day and do something really impactful. But it all boils down into the as I started off this conversation with, that chronic disease is rampant. It's massive. It is in the majority of people, and the majority of people that are listening here today. A lot of it goes undiagnosed or underserved, and the pharmacy is now in this year and the years ahead going to be leaning in very, very hard on trying to address that issue. And technologies like ours give them an anchor to have that conversation, use data to drive that conversation, and keep patients on track. So our roadmap for 2022 was to do the shoppers rollout, which we've done, expand our network, which we are in the process of doing, and those boxes are very much being checked. A lot of demand, and we will be talking more about that soon. Driving volume. We've certainly done that. Currently we represent, last I heard, about 25% of Abbott's production for tests on the Affinia. So, we're already a major global player in terms of the production volume, and opening new markets. And I can tell you that we're very much on track to doing that. And we're excited to bring HealthTab internationally in the new year. So, of course, the dollars and cents of it all, right now we've got a lot of cash out the door as we are self-funded. We are debt-free. We are not raising any money right now. We don't intend on raising any money. We are cash positive in operations already, and we are currently sitting close to $1 million in cash Canadian. That will be ticking up quite a bit over the next month or so, as now that stores are being deployed and starting to generate revenue. Our burn rate is very low, and we keep it low. Our operations do not require massive investments to acquire new dollars. So we run lean. We've been very efficient. We manage every dollar very well, and we're a really well-run organization. We inherited a cap table, or I did anyways. But right now, our cap table allows for enough of a float out there. It is largely held by insiders, but there is a float out there. And right now our volume is low, and we're starting to evangelize our message. We haven't done a lot of investor relations up until this point, but we know that in down markets, if we are heading into the bear market that most people project, one area that is going to be a strong area for investment in the years ahead, if markets are going to be tight, is healthcare. Healthcare investments are not going to go away. Governments are, if anything, going to be leaning in more into this innovation space. And so we think that this float will, and our cap table will see volume increases as people see that our revenues are going to be growing substantially throughout the next successive quarters. And people are going to catch up on our story. And we're hoping that by sharing this message today that you will too. So you're obviously going to be interested in our projections then. And so we're going to run through a couple of just income projections, cash flow projections, and just to close out this conversation. But we're presenting sort of a high, medium, low range right now in terms of what we see. The yellow would be sort of minimal. If we weren't to grow at all, if we were just going to continue to do what we're doing right now, that's what we would make. But we don't think that is where we're going to be. So we think that the year ahead is going to see a quite dramatic increase in revenues, as we see not only considerable increase of new locations, but there's a variety of factors that are going to come into play in 2023 that we think every location is going to do a lot more individual revenue. So it's a very, very exciting time. Hockey stick gets thrown around a lot, but I mean, I can't explain it any better than to say that we're going to have extremely strong revenue growth in the years ahead, and it's going to be consistent and maintainable. And so HealthTab and Avricore itself is, again, committed to keeping expenses to a minimum, revenues to a maximum, and we think that we can show very high profitability. The business is able to operate in such a way, as I said, that we don't have to spend a lot to make money, and we're committed to not diluting investors further, but we're also generating the cash that's going to drive growth. So we think that we're going to have the cash on hand that's not going to limit us in any way to grow, and we're very excited that we can be self-contained. We've now crossed that path, and that's kind of why we're talking to investors more these days, because frankly, we wanted to have the best story to tell, and we think we have one of the best stories out there to tell today. And so cash flow projection and cash on hand by the end of the year is sort of a high, medium, low range. But as you can see, we're going to maintain strong cash balances. And that opens up a lot of doors. Obviously, one can imagine what one can do. People say money doesn't buy happiness, but it certainly buys you opportunities, gives you options. And so, we're going into a very exciting time where I think that many businesses will be looking at cash crunches and cash challenges, a lot of cash constraints, and inabilities to reinvest in themselves and invest in their own growth. But that's not going to be the Avricore story. So in the years ahead, and so we think that while the investments in the years past have been impacted in a variety of ways by exciting stories, and but I think that when you head into a market like we're heading into now, the conversation really needs to be about, are these businesses in the business of doing business? Do they generate money? Are they profitable? Are they real? Is it a PowerPoint presentation, or is this a real business? Our company has proven that we can check the boxes. We're not theoretical. We're in stores now. We're rapidly growing. We're cash flow positive, and we're on track to have substantial revenues and at profitability, substantial profits in not just this year, but the next 5 years ahead. So we're really excited about that, and we hope that you will be too. Thanks so much.
Great job, Hector. Okay, we've got lots of questions for you. Let's first start with a little congratulations. Let's highlight the recent nomination of the World Business Magazine recognition for top 100 innovative companies and CEOs. You want to tell us a little bit about that?
Yeah, well, we have been toiling away in the background for some time, and it was nice to be asked and nice to be recognized, and it was particularly special because that recognition has also been offered to very traditional players in this space, companies like Life Labs, which is a major player in the lab business. And for us to be alongside great businesses like them has been a real honor. But, innovating is tough. And, often the first guy through the door gets shot. But we have managed to succeed. And we've gone through the fire, and we've gone through a lot of challenging times. And so we're really proud of the recognition, but it really goes to the team. Everybody has been absolutely dedicated to the cause. We believe that HealthTab is not, it's a great product. It generates revenues. It's going to generate great profitability. But I hope what folks watching this today feel our level of excitement is that this isn't just a widget. This isn't just a thing. It has an intrinsic benefit. There's people every day in pharmacies, thanks to HealthTab, that know that they're at risk of a heart attack or a stroke, or that they have diabetes and they didn't know it. And so the testimonials from patients have been really, there's some tearjerkers out there and some really incredible stories of people whose lives have been impacted. And we think that given the healthcare crisis that's out there, that this has real meaningful impacts, and hopefully people will invest in a product that is having that level of impact. And we're really proud to do that.
Wonderful. And it's always nice to be recognized. So congratulations.
Yeah, thank you.
So pharmacy is obviously a large established sector, but we're seeing a lot of major investments made by them in the changes of their business fundamentals. So what should investors be reading into that? How should they be reading into that?
One of the biggest risks to any business is government coming in and telling you you can't be in business anymore, right? I think we've seen a lot of companies heavily impacted by that. And I think a lot of the exciting investments over the last several years, if you think about cannabis legalization in some areas, or, I think psilocybin, and that is another area that generally gets very exciting. When you look at things like mining, obviously a regulator can come in and a new environmental rule can either make your business or break your business. And so everyone here that's an investor is familiar with that. I think you should be reading into the pharmacy sector is that instead of government eliminating revenues for pharmacy, they're really kicking open the doors for an exciting new range of revenues for pharmacy. And so there's an alignment between objectives, governments globally that and HMOs and other healthcare providers are trying to deliver cost savings. They're trying to deliver care to the customer, the patient, and they're trying to do it in a way that is going to drive better health outcomes. And so policy is now expanding the ability of pharmacy to do more business. And so now there are companies like ours that can serve that new expanded horizon for them. And so investors should be watching this sector really carefully. It's a large profitable sector, and it's making a sea change move. This is like a ADBC moment. It's incredible.
Thank you for clarifying that. Lucio P says, I've noted that there is some discrepancy in the number of blood markers that are being mentioned in recent releases from Avricore. Is it 23 or 27 that HealthTab has effectively identified? And secondly, is post-concussion testing being added to the suite of markers?
So it's a good question. We made the transition from using the Abaxis Piccolo, which is an instrument made in California. It was a really great instrument. It was literally developed for the space station. And so it's had an interesting career. It went from space station to a lot of doctors' offices in America, and U.S. militaries use it at clinical trials. They were purchased. Point of the story, which gets really funny, is that they were purchased by a company that is now focused on animal health. So it's literally gone from the space station to the farmer's barn. And so we found that the pharmacy space and the human health space was really being focused on by Abbott. They made a series of acquisitions. And so perhaps the discrepancy of the markers is only just that. The Abaxis Piccolo does a lot more markers, but one thing that it didn't do was the blood glucose and looking at diabetes and prediabetes. So that would be the issue there, is where as we phase that analyzer out, but we'll still use it from time to time, but it's less of a focus for us. And then the question around post-concussion syndrome is a great question too, because there is a really exciting test that's coming out that's going to be available on the Opinion that is going to be able to look at some of the proteins that are released post-concussion. So we are looking at that. We have discussed that with them, and there's some regulatory timing that in terms of approving the test and whether or not scope of practice will allow I think it takes more of a venous draw, which means you need like more of a vial of blood. It uses a serum rather than the capillary stick. But it goes to show that this is going to evolve really rapidly in the years ahead. And there's just so many cool things that can happen in community pharmacy. Like where we're at now, we're just scratching the surface. And so HealthTab is also not solely dependent on one test manufacturer, one instrument. So as new instruments and new technological evolutions occur, we can adapt to that, because we're not bound by the instrument. It's a network, and we can connect virtually anything to it. And that includes things like continuous blood glucose monitors, which is a fast growing area. So getting wearable data into it as well. That's something that we're looking at very closely. Fantastic.
Gary P wants to know, where do the fees come from, and how do you grow that network?
The fees, where the fees come. So the pharmacy groups themselves pay the per location fee. So it gets them, again, the the integrated software solution. It gets them the patient interface and the interpretation, as well as the oversight and the instrument. And so they pay that as a cost of doing business. And what they are then turning around and how it works from their side economically is we generally encourage that the patient is not charged for the test. And the reason being is that there's a variety of means in which the pharmacy can make revenues from the HealthTab platform, from new prescribers to driving them into other service revenues. In Canada, for example, and in America, they can charge for things like medication reviews and consultations with the patient. So they just include the test with that now. But in Canada, it's important to note that in early 2023, most people expect that government will start to remunerate or start to pay the pharmacies to do this type of testing. They'll actually directly pay them to do it. And that seems to be where things are going. And I think most people are expecting those announcements in the not too distant future. And so that is going to have a profound impact on the amount of revenue that the pharmacy can make and drive, to Gary's question, it drives inherently the value of having the system on site. You're happy to pay the service fee. Right now, the service fee is nominal to their business. They're making money right away. But we're finding that we've hit a real sweet spot in terms of strong revenue for ourselves, very easy to absorb from the pharmacy group, and the pharmacy can make money with it today. But as I want to underscore, those revenues for them are going to dramatically increase in the years ahead, driving even more demand for us.
Great. Bob Cheetah wants to know, when is HealthTab going to be deployed in the U.S.?
It's a good question. We are looking at that in those conversations. It's an interesting market where Canada and Europe and the UK are more greenfield in terms of there's not really a lot of solutions deployed. America is actually really progressive when it comes to point of care testing. There's actually a lot of solutions and machines out in pharmacies today, and pharmacists have been allowed to do a lot more testing in the States compared to other jurisdictions, and the rest of those jurisdictions are catching up now. So we're in talks right now and finding ways of either overlaying and using more of a software as a service model where connecting existing devices out in the market or deploying HealthTab in our more traditional market model. So we think the US is a very exciting market. However, we also think that one should not underestimate the power and the size of the UK market or the EU market. They're very interested in this type of technology.
Gregory Inns asks, are you expecting institutional investors to invest soon? And when will the first pharmacy outside of Canada come on board?
Two good questions. So institutional investors, we've had a lot of conversations. They love our story. Our revenues haven't been in this sort of sphere they have sort of a box and you have to fit in it. But our revenues are getting there. So we are getting a lot more interest now that they've seen that we're cash flow positive. Now that they're starting to see the revenues uptick, we are getting a lot of phone calls. We are getting a lot of interest. We are starting to see some buying. So I anticipate through 2023 that the institutional folks are going to catch up on us. And we're going to fit that box. And I think we're going to see a lot of success there. The second part of that question is, when do we see the first international HealthTab locations? I think you'll see it in Q1 of 2023.
Fantastic. Rob D wants to know, are you going to get caught up on the filings on the OTC market side of the public company?
Caught up? I'm not sure what you mean.
Well,
all of our filings are, as far as we know, are all up to date.
Are you caught up to date on the OTC market? Okay, there you go, Rob. We have a question. Whilst the world of pharmacy is expanding, I wanted to say that word, whilst, what is the potential for AVCR to expand? You've mentioned some of that. So talk a little bit more about expansion and also genomics. Is there potential for genomics within your platform? And is that an area of interest?
Very much, yeah. The ability to connect HealthTab to exciting areas. I talked about wearables. Wearables is very interesting because some diseases are really about time and range. So it's not just about that testing event, but like how an individual over a long period of time is doing is really the marker. So we're looking at that. Pharmacogenomics, we have looked at a variety of those options. There's some very interesting opportunities to offer pharmacogenomics, which for those, it's a long word and it sounds exciting, but it's basically doing your genetics. It's like 23andMe or anything like that. It's like if you're doing your genetics and you're matching it to the drug's DNA and looking at how that drug serves you, because Anna, like you could take a drug and I could take a drug and it works like 75% for you, but it works like 13% for me. So it really depends on how we match up with the drug. So pharmacogenomics is a really exciting field. And we do anticipate being able to, it's not a matter of can we do it, but what are the questions for pharmacogenomics at this right now? It's not our question to answer. It's really those companies' answers to make it economical for the pharmacy. So somebody that figures that out, we're going to be very interested in that conversation. So far, the things that we've looked at, they're really great, but we're looking at something that's going to make sense economically. However, I'll close this thought by saying, if a pharmacy is offering it, and if they want it, so let's pretend we don't directly partner with them. But if the pharmacy is offering that service or already, or any type of testing service, it can be reported through HealthTab. So that is one of the key features that we can offer, is that a pharmacy now has a one window in being able to communicate testing results in a reliable way, in an easily understood way to the patient. And some might be thinking, well, why couldn't they just build that themselves? Well, they've tried, and if as we've seen so many times that two people can make a software, and some people do really good at it and some people aren't. So you really have to be whether or not you're an expert at it and particularly talented. And I will say that Roger Seckham, who developed HealthTab, is extraordinarily talented. Our system does not have downtime. Our system is extraordinarily secure. It's extraordinarily progressive, we have been able to work with the highest levels of partners. And I think that they've really valued the fact that HealthTab is such a sophisticated solution. It's not a bolt-on. It's not an afterthought. It is extraordinarily well thought out, and it's really built for the future and has a lot of ability to grow and offer different types of testing.
Great. Last question, Hector, from Harry Pat. Any long-term care pharmacy penetration?
We've had some really interesting conversations in that area. And, we think that, for example, our clients, Loblaw shoppers, they actually have something called Meta Systems, which is an outbound pharmacy offering to long-term care. And so we are in discussions with them about finding the right model to make that work. But we definitely think that long-term care and the pharmacists being able to have access to information while they're not physically on location, because the service that they're providing is like maybe the pharmacist is on site every couple of weeks or every 4 weeks. So the fact that they would be able to offer and see data in real time while they're not there has been something that's been desired. So it's another area where we see a lot of growth potential.
Well, fantastic stuff, Hector. Thank you so much for your time and your thorough presentation. We would love for you to come back with some more exciting updates. Thank you.
Well, I really appreciate the opportunity. Thanks, everyone.
Well, great day so far, everyone. We've had so many wonderful companies, thrilling time on the Emerging Growth Conference. So thank you to all who's watching. Remember, in just a second, you're going to be redirected to the registration page for our next conference. Reserve your spot early. On behalf of all of us at Emerging Growth, thank you to all of our presenters and attendees for making this such a great success. Remember that a complete replay of the conference will be on our YouTube channel, youtube.com/Emerging Growth Conference. Also follow us on Twitter at Emerging Growth C. I'm Anna Berry. On behalf of myself and our entire team here, thank you so much. We wish you a successful, happy, and healthy rest of your week. We'll see you again soon.